Today's video is about vaginal tearing. I will be sharing with you 7 midwife approved tips for smooth delivery, especially for first time moms or you've had other babies and you have questions like, I don't want to go through vaginal tearing again, or you are a first time mom and you don't want to go through that and you are looking forward to, is there something I can do? I am here to tell you that yes, there is what you can do. That is what this video is about. First of all, congratulations on your journey, on looking forward to meeting your baby eyeball to eyeball. Whether you're in your 30 weeks, 36 weeks, just let us know in the comment section because I am routing for you. Welcome back to NK Fertility Solutions, where we talk everything pregnancy, fertility, and your holistic living backed by faith. So we're going to be starting by understanding what really is vaginal tear. During childbirth, the area between your vagina and your anus, which is called the perineum, it stretches so that the baby's head can come out without any struggle. Sometimes that stretch can be too much, causing small or deep tears. There are 4 stages of tearing. We have the first degree, which is very minor, only skin deep. We have the second degree. This type of tearing, it goes deep into the muscle tissue. It may need a few stitches. We have the third and the fourth degree. These are more severe, but are not all that common. Tears happen for different reasons. Maybe it's your first vaginal delivery, a large baby, fast pushing, or a rigid perineum that hasn't been prepared. So let's move over to 7 tips to prevent this tearing, because for some women it can be very scary. The discomfort it's on another level, very painful. Okay, so we're going to be looking at what can I do right now that I am pregnant, or after delivery and during labor, what can I do? We're going to start with what is known as perineal massage. You usually start to do this from week 34 to week 36. This is how it's done. You just need a clean hands, natural oils, like you can use olive oil, you can use coconut oil, you can use vitamin E oil, you can even use sesame oil. Just insert 1 or 2 fingers, just about an inch inside the vagina, and gently stretch downwards and side U shape like that. Okay, do this for 5 to 10 minutes, 3 to 4 times a week. This helps your perineum become more elastic and ready for stretching during delivery. The second proven tip you can use is to use warm compresses during pushing. Research shows that placing a warm, moist towel on the perineum during the pushing stage helps soften the tissue, increases blood flow, and reduces tears. So ask your midwife or your bed partner to apply a warm compress when your baby's head begins to crown. It is simple but very effective tip. Next is practice controlled pushing. I actually made a video explaining how you can breathe during your pushing, during your labor. Okay, this is very important because it's actually how you push determines whether you're going to have tear or not. Okay, so don't rush the pushing stage. Controlled pushing helps your tissues stretch gradually. So instead of holding your breath and forcing the baby, breathe and push with each contraction. I spoke about this in that video. When you feel the burning or stretching sensation, it's your cue to slow down and allow the tissues to open gently. What is choose the right birth position? Very important. Lying flat on your back increases pressure on the perineum. Positions like side lying, hands and knees, or semi-sitting can reduce tearing. Gravity helps and your perineum is under pressure. Eat for skin elasticity. Yes, nutrition is playing a huge role in this. Foods rich in vitamin C, collagen, zinc, and omega-3 fatty acids make your skin more flexible and resilient. So include citrus fruits, avocados, bone broth, eggs, fatty fish in your late pregnancy diet, okay? And drink plenty of water. Hydration keeps tissues supple. Number 6 is skilled perineal support. You need a skilled perineal support during childbirth. Okay? A good midwife knows how to support your perineum as your baby's head crowns. They may use gentle counter pressure or guide you to slow down. This is called the hands-on technique. That human touch makes a world of difference, okay? So don't just choose anyhow hospital, anyhow midwife. Be very, very specific. You want an expert that knows what he's doing. Is your life and your baby's life we're talking about here. Finally, is avoid routine episiotomy. Past episiotomy, that is cutting the perineum, was routine, but studies show it can cause more harm than good when not medically necessary, okay? Only allow it if it's really needed, like in an emergency where the baby must come out quick. Now let's look at after childbirth care and healing. So if you experience a minor tear, don't panic. Your body can heal very, very beautifully and fast because down there is highly vascularized. It has a lot of blood tissues that supply with blood, meaning enough oxygen so it can heal quickly. Don't panic, relax and follow the procedures. First, keep the area clean and dry. Secondly, use warm steam baths daily for comfort. You need to eat fiber-rich foods to avoid constipation and straining. Very, very important. Next is don't do gentle pelvic floor exercises once your doctor approves. And finally is rest. Your body needs to recover. It needs all the rest it can get. Remember, childbirth is natural and your body is beautifully designed for it. By preparing early, working with your birth team, and trusting your body, you can reduce your risk of tearing and enjoy a smoother, more confident birth experience. You wish above all things that you and I prosper and be in amazing health. Even as I was so prosperous, I'm routing for you.